We're going to go right forward into our second section on implementation, and Nick is our topic leader on this, really thinking about getting this into the workflow. And we know right now, Nick's team is working on this, and we've had some starts and stops, learning experiences. We've been getting a lot of feedback on them on what we could improve on the tool to bring more value to the tool. And so, Nick, what considerations did your team have to make to really think through how to successfully implement a screener like this and, bring it into the workflow? What kinds of give and take have you had to think through?
Yeah, that's a big question. So one thing about agency work is there consistently seems to be more paperwork and never less. And so our first consideration was, is it going to be worth our time to invest and try to make it work? Is it going to give us a return on investment, essentially? So that was our very first question. And how we came to that answer, which was clearly yes, because here we are, is the workloads of the clinicians. Like I said at the beginning, the trauma systems therapy clinicians often have to serve as case managers in addition to clinicians. And so we were particularly drawn to this idea that we could map resources and identify those needs early in treatment rather than later. And so we're like, okay, let's give it a shot. On top of that, we did go through kind of this iterative process like Danielle was talking about, where we would administer the tool, come back with feedback, make some changes and alterations, which has been really great. Even prior to this, we were in a meeting, maybe 20 minutes before. So we've been constantly revising what that looks like and how it works. Some considerations we had really were around the prioritization of it, like as far as clinical staff goes, where do we put this in our terms of need? And what we found is that the earlier we do it, the better off we are, rather than delaying it until later in the process, because we want to know where those needs lie. And sometimes the intake questions that are asked, at the time of the mental health screenings and things aren't really sufficient to identify those. So we also have looked at issues with, client follow through, because our clients are very high need. How do we go about implementing this as clinical staff so that we can improve the follow through of our clients following the recommendations for services and even completing the screener? So we talked about the best ways to do that. With COVID and everything, we were looking at kind of a hybrid. We would need a way to administer this assessment both virtually as well as face-to-face. And so we were trying to figure out, well, how do we make that meaningful for people? And that's really what drove the addition of that alert that I spoke about just a few minutes ago. If we did administer an assessment virtually and we had no way to follow up with that, we wanted a way to alert staff that something was pressing and immediate, and we could act on that. So that was one of our implementation things. So we looked at administering through tablets that clients could take and use, or
financing technology services.
We could do
our conference rooms,
computers or email, those kind of things. So it worked out rather well.